Okay, so let's begin with a standing assessment. So with your eyes closed, just stand there on the spot with your shoes off. And just bring your attention first of all to your feet. So as you stand there, notice, are you loading more weight into one foot compared to the other? And notice, where is the weight transfer through your feet? Is it through the balls of your feet? Is it through your heels? Is it along the outside of your feet? Or do you feel it on the inside? Is the weight transfer different between your left and your right foot? Just notice. And then when you've identified this, let's travel from your feet, through your ankles, all the way to your knees. And just notice with your knees, are both knees bent? Or are they both locked and straight? Or do you notice that one knee is slightly bent and the other one's locked? Do your knees come close together as if they're knocked knees? Or do you feel that your knees and your kneecaps point outward? And then from there, just travel along from your knees all the way to your hips. And bringing your awareness to your pelvis. So first of all, do you notice if your tailbone is tucked up and under? Or does it feel as if your bottom is sticking out, which allows your belly to pop out and for you to develop a quite tight, tense arch in your lower back? And in this area here, let's just notice the hips. So do you feel that one hip is slightly hitched or higher than the other hip? Maybe you feel that your hips are twisted or rotated. And let's just notice here, if you open your eyes and you look down at your feet, notice the position of your feet. Do you notice if your feet are turning out? Do you feel your knees are turning out with your feet? Do you feel one foot is further in front than the other? And does that have a correlation with your pelvis and your hips? And then close your eyes again and let's bring your awareness into your somatic health, into the internal environment here. So from your hips, let's now travel along the back of your body and through the sides of your body all the way to your armpits. And notice as you stand there, does it feel as if one armpit is pulling down towards one hip more on that one side compared to the other? Or maybe do you feel that your shoulders are pulling forward, as if your ribs and your chest are pulling you down toward your pubic bone and your head is jutting forward with that action? Maybe you feel that your shoulder blades are pressed back and that's contributing towards that lower back arch, for instance. So notice where your shoulders and where your armpits, where they sit. Are they slumped to one side? Are they drooped forward? Or are they set back? And then travel from your armpits just to the top of your shoulders. And notice, does one shoulder feel as if it's closer towards your ear compared to the other side? Or does it feel as if both shoulders are hitched up towards your ears? And then once you've noticed this, let's travel from your shoulders along the sides of your neck to your head. And let's see your head position here. So do you feel that you're looking straight ahead? Or do you feel as if your head is turned looking towards one side more? Maybe you feel as if your nose is in the air, as if you're looking towards the ceiling. Or maybe do you feel that your head is looking towards the floor? And so with your eyes closed, let's see if we can just reset or recalibrate and see if you can just reposition your head and your face so that your nose is looking straight ahead and your nose would be in line with your pubic bone. Can you orientate your head to this position? And then very slowly just open your eyes and let's take a walk around the room and notice how you feel as you walk. And this can be applied to your movements that you do on a daily basis as you walk to and from work or to the car. So as you walk around the room, notice, do you strike the floor heavier with one foot compared to the other? And as you do, notice, where do you strike first? Is it the heel or is it the balls of your feet? Are you noisy as you walk around? And then as you continue to walk, just travel or bring your awareness along your legs to your hips. And as you continue to walk around, just place your hands on your hips and notice the level of movement that you have coming from your hips. So as you walk, do you feel that you have a little wiggle from your hips? Do you feel that both hips move freely? Or do you feel that one hip is more stiff and that leg seems to drag with the walk? And then once you've identified this, just place your arms back by your side. And as you continue to walk around the room, notice as you do you have a little twist of your torso as you walk? Or do you feel that as you walk, you're pretty rigid, almost robotic in nature? And bring your awareness to your shoulders and to your arms and to your hands. So whilst you walk around, where do you feel there's most movement? Do you notice your hands moving? Do you notice your forearms to your elbows move with the walking? But do you notice if your shoulders are moving with the action of walking? Or does it feel as if all the movement is coming from your elbows, forearms and hands? And then finally, as you walk around, how much movement do you have with your head? Does it bob freely? Or does it feel stiff and locked on your shoulders? And then slowly stop and come to a standstill there. And so as you stand there, just notice, do you have a natural sway as you stand on the spot there? Or do you feel rigid and stiff? And so use this awareness so that when you get down onto the floor and you start doing your daily somatics practice, at the end you can revisit this standing and walking assessment and notice what's shifting and changing for you. And also, if you are walking to work or from work or just going for a leisurely walk, use this assessment to see what's tight, what's not moving. And then with your somatic practice and the knowledge that you're learning through total somatics, you can reset and recalibrate and just make those tweaks and those fine adjustments to create more equilibrium, more balance, and more fluidity in your movement. Take care.